Okay. Today we're going to demonstrate putting in a female Foley catheter. And all you will need in order to do this is you will need the Foley catheter kit. You will need a Foley stat lock. You'll need regular gloves. You'll need your sterile gloves. You'll need, because we're working with mannequins only, you'll need the lubricant for the mannequins. Otherwise you would use the lubricant in the kit. And you will need a basin and washcloth. If you have a patient that chills easily, you may also want a warmed bath blanket. I saw that. May also want a warmed bath blanket to put over the top portion of them as you are working. You will start as usual by coming in, introducing yourself, and verifying the identity of the patient. Mrs. Alexander, hi, my name is Diane. I need you to state your full name and give me your birthday, please. Thank you, that's correct. Well, of course it's correct, you idiot. What do you think? Okay. Okay, now what we're going to be doing today is we're going to be putting a Foley catheter into you. Have you ever had one of those? I don't think so. What is it? Well, you're going to be going down for surgery, as you know, and because there is the possibility, if you have any urine in the bladder, that it could leak out onto the table. We want to make sure that that doesn't happen. And so we're going to put a Foley catheter into you, which is simply a tube that comes from outside up into your bladder and drains the urine out into a collection bag while you're on the table. This will probably be in for a short time afterwards. In most cases, it's out fairly quickly after the surgery is complete. Do you have any questions on that? Then you're okay for putting that in? Well, if the doctor wants to. Okay. Now, let me go ahead and just cover up the top of you, because I know from the past few days that you tend to get chilled. So let's keep you as warm as we can. I'm going to have to be exposing the bottom portion of you, obviously, in order to be able to get this thing in. Now, are you able to assume a frog-like position? It's called dorsal recumbent, is the position for a female. But basically what we're doing is we're having you become a frog, putting your knees out, your heels together to open the area that I need to work in. Oh, sure, I can do that. I do yoga, honey. Okay, then. Now, before I go any further, I'm going to verify, does she need any cleaning before we get started? Okay. I will also want to have washed my hands and pulled the curtain for privacy. Even if she's in a private room with the door closed, pull the curtain anyway. And I'm going to verify, does she need any cleaning? If she's been incontinent or whatever, you have brought a basin with some soapy, a nice warm soapy water in it and a washcloth, and you would go ahead and clean her up before you went any further at this point. Okay, then we're going to make sure that she is able to take the necessary position. And that is with her knees up and out, and with, in order to maintain that position, you can put her heels together. Okay. And let's give her what privacy we can while we can here. Are you able to maintain that position? Yes, I can. Now, if you'd like, you can go ahead and pull the covers back up over her until you've actually finished your preparations. That would be okay, or you can leave her like this if she's not getting cold. Okay, I don't need the basin at this point, but I will need it later because I don't want to leave the betadine on her when I'm done. So I'm going to just set this right down here and open my kit. There is information on the label of this kit that you will need if you are charting this, and you should always chart if you put a Foley catheter in. You will also, if you are in the hospital, add altered urinary elimination to the care plan. It would be even better if I could get the thing open. careful with these things. There you go. Okay. Now I'm going to save this bag because I'm going to use this for a wastebasket over here as I am cleaning her. Notice on the label of the bag there is information that you will need. It tells you that this is a Foley catheter and this is a Foley tray or Foley kit. It is a 14 French. Underneath it says it has a 5 milliliter balloon, but you're going to fill it with 10 milliliters. And you would want to note how much is in the balloon for a nurse that is going to take this out. It also verifies that it is not latex, and there is an expiration date on it that you're going to want to check as well. This one expires November 30th of 2023. Can you pause it for a minute? I need to cough. Okay. And we will want to put this piece under her. This is the one time you can reach in without your sterile gloves to get this top piece out. Lift it out away from there immediately. This is so any spillage or dripping that occurs as you're putting this in is caught and you don't have to change bedding. You'll notice there's a flat side and a shiny side. The shiny side is always down. This will go between, and you can have gloves on for this if you prefer. And you are going to tuck it in under her bottom. If she's able to lift her bottom, all the better, but it's okay if she can't. You can still tuck it in. Okay. Now, at this point, I am going to need sterile gloves. Before I do that, I am going to move my kit over so I have a little more room for the top portion of the kit. Once I have touched the outside of this box, it is considered non-sterile, but even if nothing has touched it, the outside of the box is always considered to be non-sterile. I am then going to put on my sterile gloves. That's fine. Move your body so that you do not come across the other glove as you're putting your first glove on. This piece, some people use, some people don't. If you have someone who is young and shy and uncomfortable being exposed, you can put it across the patient. You can also use it with the male and simply have the male protruding through this. The nice thing about this is that if you touch against the patient, you're actually touching a sterile piece of paper. And that's the advantage to it. The disadvantage is that on a female, when you are searching for the meatus, it makes it very difficult to find. Most nurses that I know do not use this. I would like to turn this. able to, okay? That's all right. Okay, so the next thing I'm going to do is to take the cotton balls and separate them because they tend to stick together rather badly. And open the betadine, only we will not actually open it because it stains the mannequins. So open the betadine, you would pour it over the cotton swabs, and then keep the package, and on your field here you will simply drop the package, label up. Joint Commission requires that anything that you're cleaning with be, anyone coming in can see what it is without having to ask you. I'm then going to separate the two pieces of this. I can only handle it from the inside. I cannot grab the outside. It's contaminated. So I'm going to pick it up, come out of my field and back in. And I'm going to first prepare my catheter. Remove the blue cover carefully with good control over the catheter itself and set it back down inside. And you will put on the syringe with the sterile water in it and have it in place on your catheter. Okay. All right. Now we are ready to prepare the catheter further. The only thing left to do here is we need to lubricate the catheter itself. For a female, that's going to be approximately 2 to 3 inches that you're going to need to lubricate. Thank you. We're going to insert the female catheter. About 5 inches is usually enough on most females. All right, so my catheter is completely ready, and I am ready to bring it over between her legs. I still need 2 sterile gloves because in handling this, I can only handle it from the inside of the box, so I will take it from the 2 corners, pull in opposite directions, bring it over, and set it down between her legs in such a way. I am now ready to clean her, and this hand now becomes a dirty hand. Remove the gown, pull it back. And on these mannequins, on a regular woman, you could slide down between the labia and spread your fingers and have exposure. On these mannequins, you have to go about halfway down this dividing crack here. In the middle, press down on either side, and you'll have to hold that the whole time you're cleaning and the whole time you're putting it in. So, first, labia majora on one side, toss. Labia minora on majora on the other side, toss. Labia minora on the first side, toss. Labia minora on the second side, toss. And down over the meatus. Okay. Now, we are ready to go in. You would have clitoris, meatus, vagina. Not nicely lined up like this on any human being. You're going to grab the catheter and come in to the meatus and just keep pushing. And it's harder on these mannequins than it is on a real human being. Nothing. That helped, I think. Okay, and I have urine. Okay, I have urine, and I obviously would not have actually touched. Okay, I'm going to take it about an inch further once I have urine, in order to be sure that the balloon is completely within the bladder before I inflate it. At this point, I back my fingers up without turning loose of the catheter, let it close around it, take hold of the catheter just outside the lips, and I reach for my syringe and inflate the balloon. At that point, I can release the catheter here because the balloon will hold it in place, and remove my syringe. Gently pull. Okay, then you're ready to do two things. We're going to hang it, but I want to be sure it doesn't pull on her as we hang it as I go. This is a Foley stat lock. You open it up. Maybe. There we go. And the Foley itself, the catheter itself, will come in here right at the Y and close. Okay. This will then go on the inner thigh. And thank you. I was just going to do that next. And you want to always place it on the inner thigh in such a way that there's give between the patient and the catheter and the stat lock. The nice thing about the stat lock is it swivels as the patient moves and allows a great deal of movement without pulling on the meatus, and on the area of the meatus. Now, before I do anything else, because I have betadine on my gloves, it's going to make sense to remove the gloves and put other gloves on so that I'm just not smearing betadine all over everything. Okay. And now we're ready to hang the bag. We're going to bring the bag up and out. We can get the box out of there now. And just behind the top rail on the underside of the frame of the bed is a metal loop on which this hangs. And when you take this, you can turn this so that now it hangs easily. Okay. Then you will form a loop on the bed so that it's pretty much a straight drop down to the bag for the urine. You don't want to just let it hang and make a loop at the bottom of that area, because what happens then is the urine gathers in the bottom and it stops draining. Okay, you can use the little alligator clamp that's on the tubing to help hold that loop in place by attaching it to the bedding. If the doctor has asked that you get a sample, you can, in the very first urine that comes out, you can use the little sample bottle in the kit and drain directly from the bag into the sample bottle. But if it has been even a few moments that it has been in there, you can no longer do that. And what you would want to do then is get a 10 milliliter syringe, clean this port just as if it were an IV port, use your syringe to draw urine out directly here and put it into your sample jar. You need 20 to 30 milliliters to send down to the lab. If there is no urine gathered here and you need some, you can again use your little alligator clamp, come on up toward that blue port, clamp off your tubing, and use the alligator clamp to hold it while urine gathers in here. Draw your urine sample. Be sure to unclamp it afterwards. Okay? Now, you're going to remove this pad from under her and any other trash. And at that point, you will go ahead and use your basin. She can take a more comfortable position now. You take the basin and you will open her and wash any betadine that is in there off, because betadine left in a warm, moist place like that will macerate the tissue. So you want it removed. Okay, leave her in a comfortable position on the bed. Be sure she is comfortable. Ask her if she has any questions or any needs, and tell her whatever else she needs to know, such as they'll be coming up for you to take you down to surgery in about 30 minutes. Okay, and that's putting in a female Foley.